And so I want to tell you what these concerns are, and they might be your concerns as well. They certainly are mine. Number one, Obamacare will provide health benefits to illegal immigrants. Now, this whole system of health care is imploding, and one of the reasons for it is because of taking care of folks that are not American citizens. They're not paying into the system, and yet we are forced by law to take care of them. Now, I'm not opposed to immigration, but I think we should do it in a legal manner. But that's a whole other story, and we don't have time for that. Let me just tell you this. Irwin mentioned House Resolution 3200. That's the main bill that's under consideration. By the way, there are 3 in the House and 1 in the Senate. And all 4 of them are different, if you can imagine that. All 4 are different. The administration, the Obama administration, has never proposed a health care bill themselves. So the executive branch has never said, here's what we want to see done. So they're just waiting for the legislative branch to fight it out, I suppose. There's a representative by the name of Dean Heller. He's a Republican from Nevada, and he proposed an amendment that said we would have a test to be sure that our health care dollars were being spent on American citizens. Well, it's no surprise that the amendment that he offered was defeated and right on party lines. You can imagine which side went for what in that vote. Second, another concern is this, and it's very, very real. Obamacare will lead to a government takeover of the health care system. Now, when you hear this term public option, that simply means the government taking care of the entire program. That's what that refers to. I thought it was very interesting that in a town hall meeting in New Hampshire, the president said, oh, we're not planning to have a public option. And yet that's been the centerpiece of the entire legislation from the very start. And I was stunned when I heard that. He said that's not even in the legislation. And I imagine there were a lot of people in the room looking around saying, where's this guy been? You know? Because that is the legislation. The public option is the legislation, government control. And I think primarily we're talking about a situation where the government ultimately will control 1/6 of our economy, which is our health delivery system. 2 days later, I thought it was rather comical. 2 days later, after the president said, oh, we're not even talking about government control here, the Senate took that out of their legislation. It was in the legislation and they took it out. Now the talk has switched to cooperatives. And the cooperatives are just another way of saying government control. They're government funded, they're government controlled by an agency, and they will lead ultimately to complete control. There's that word again. A third concern that people had in this poll was that Obamacare will use tax dollars to pay for women to have abortions. That's been pretty much off the table for a long time. But now this bill will put it back in. To try to prevent that from happening, the Senate offered on three different occasions, offered amendments to the legislation to be sure that abortions were not paid for with your taxpayer dollars. In every instance, they were defeated. They know for sure that it's in there. And the administration's promise to provide to the main agency that provides that kind of care, reproductive care, is very, very interested in this legislation, and it's coming. Number 4, and this is the last one, and this is one that really gets our attention, is this. There is a provision in the bill that's called comparative effectiveness research, and it actually is to determine which medical procedures are most effective in treating a special ailment. Well, you know, that sounds good, but when you put a person who is a government employee in the position of making that kind of decision, first of all, it's very obvious that your doctor's no longer making that decision, but a government employee. And I don't think there's a person in this room who wants that kind of a thing. And more than that, probably most of the people in this nation don't want that kind of a product as far as final results in health care. There was, as you can imagine, there were amendments offered to say, okay, well, let's just be sure that this comparative research that you're talking about here does not apply to choosing what coverage or what procedure is to be done, or which procedure is to be withheld, or that it would never lead to rationing. And we won't get into that. Maybe these gentlemen will talk about that tonight. But that amendment was offered 3 times, and it was defeated all 3 times. They know that it's in there, and yet they say that it's not, and they won't take action to remove it. So it's serious. It's a serious time for us all as Americans. Carol asked me to speak from the insurance perspective, and the more I read, the more I thought about what to say. I decided that it'd be a lot better if I used the insurance perspective, but coming from the legislative perspective as well, because the legislation which is now being considered will ultimately become the insurance that we're dealing with. One thing people call health care, and they confuse that with health insurance. Health care is what you receive from your physician, from your clinic, from your hospital, from the vendor, whoever who is providing it. Maybe it's rehab, maybe it's nutritional. It can be any number of things. That's health care. But what we're talking about in Washington is health insurance, which governs what kind of health care we receive. And so I think it's important that we keep that in mind. Let me just offer some things that I believe that the American people would like to see in their health care, health insurance program. Number one, I think that the individual American would like to be the consumer who has the authority to take action and do what's necessary to receive the kind of care that's best for me, the customer. The patient makes the decisions, not some insurance company, and certainly not a government agency. Secondly, I think that the individual buys and owns their own coverage in a value-cost basis. Value and cost enter into nearly every purchase that we make. For example, picture the mom and her children going to the grocery store, and they're going back and forth down the aisles. Now I'm going to tell you a story, and many of you have been right there, and you know exactly what I'm talking about. You get to the cereal section, and what do the kids say? Hey, Mom, I want that one. I want that one. But Mom's read the label, and she's a little more interested in nutrition rather than the one that's loaded with sugar. And so she is going to make the decision based on value, not just cost. And we want us to be involved in that, not a government agency somewhere. The consumer, the patient, needs to be involved in that decision along with our physician. Number three, we need to choose our own coverage, not have the government tell us what's best for us. We want to make our own decision. We're Americans, and freedom is the part of our life that we'll never, ever give up. You can go anywhere in the world, and you'll find various levels and understanding of freedom. But there's one place that we know for sure what freedom is, and it is America. We are Americans.